talking to Merrilyn Walton and we're at the IAMRA conference on international medical regulation. You've just presented. Can you talk about what it was, because it's very important really for the future of medical regulation in Australia and having been through a big process. So What were you looking at?
Okay, we had an Australian Research Council grant to do an in-depth study of the Australian health practitioner regulation system. And in Australia, it's a complex system because when it came to complaints, New South Wales didn't join the national scheme. So our research was looking at whether the national scheme was any different to New South Wales in terms of complaint handling and other decisions around regulatory practice. And if so, to compare and contrast them to see which maybe is the best model. Mainly on the basis that a lot of regulation to date hasn't had a lot of evidence underpinning it. And so the research was aimed at getting evidence in relation to a number of areas of regulation, but today we specifically focused on the consumer experience of regulation.
And why did you do that particularly and here?
Well, because, in the last 5 to 10 years, the role of consumers in healthcare has changed enormously. Most of the colleges, the hospitals, all their systems now recognise the importance of patient engagement in their own healthcare and also recognise the role of patients in broader systems improvement. And yet in regulation, which has been around since the mid-19th century, the role of consumers has been rarely highlighted. And in addition to that, though, their role in regulation is central because the role of regulation is protecting the public. So we have a system of complaints that is really some of the core business of regulators, and yet complainants are not very happy with it. And what our research showed that they're not happy in Australia.
Can you just go through that briefly? What the main findings were and where they compared?
Right. So for 12 months, for every complainant under the New South Wales scheme or notifier under the national scheme, we sent them a survey and we asked them a number of questions about why they made a complaint, the types of complaints, what happened to them, and what they would like to see change. And the results are that most of the complainants are unhappy with both the process, it's too slow or they're not given enough information, and they also don't think, though, there's enough information in relation to how can it not happen again. So the summary of the findings are that consumers are generally unhappy in all areas, and this is not dissimilar to other countries. And also there's not much difference between New South Wales and the national scheme. So we need to start looking at, it brings up the question, well, what is the role of consumers? Because many of the regulators see once a notification or a complaint is made, they step aside. So the provider gets a lot more information and transparency often than the consumer. And it's not because the regulators are purposefully doing this, it's the design of regulation who traditionally not included the consumers or the complainant as much as they would like.
And can we say the range of type of complaints that you looked at where that same outcome happened?
Well, the range of complaints, most of complaints are around treatment, and then followed by conduct, and then there's other things around medication and not responding to complaints and so forth. And complaints about treatment being the most complained type is not different to complaints to the health care complaint commissions around the states and territories. Treatment is always the major type of complaint. In terms of whether matters go to investigation and continue on to disciplinary matters, often most matters don't do that, of course, naturally, but of those that don't continue on to some more formal, serious outcome, the complainants don't understand why. They're not given that information. There's no transparency around the decision making.
So can we come back to consumers, but just in the context of your study, and there's been a lot of debate about the medical regulation in Australia going national and including all the other professions as well. Did you resolve that tension?
Yes, well, I think that tension's been resolved just by time. I mean, APRA now is 6 years old. It started in 2010. I think nationally there's been a lot of applaud from the community and providers about registration. That means the doctors can practice wherever you like. But in terms of complaint management, we still have we have differences in approach between New South Wales and Australia, and I'm sure there's approaches that could be improved upon in both jurisdictions. But we didn't get the feeling that people were complaining about the national system or they were just generally unhappy about the little information they were provided, the outcomes that they thought they would expect but didn't receive. And also I think that they think that the weight of their story, their narrative of what happened to them, wasn't a major consideration by any of the agencies.
So have you made recommendations about how to address that?
Well, we haven't, because we're still analysing all the 5 studies, we haven't made that. But for me, it personally, it raises a number of questions. And the first one well, do we need to rethink the role of consumers? Maybe when they make a complaint that it's more than them just being an informant. And I recall when I was the Healthcare Complaints Commissioner, we had a report from a doctor saying he didn't have a lock on his door in response to an allegation of boundary violation. And so we believed the doctor, but then another complaint was made and we subsequently visited and found out he did have a lock. So, you know, there are very, very simple things where complainants feel that regulators may miss because they don't go back and check. It's assumed that someone's telling the truth. And, you know, in most investigations they try to get subsequent evidence to either support or not, but still, even in that process, the complainant's not involved.
So are you seeing that this is going to lead to a role for consumers and complainants, because not all complainants are consumers, obviously,
Yeah.
but is that a role, do you need it in a structural sense in the big organisations, the big agencies like APRA, or is it trying, and we heard today about taking more a restorative justice approach to resolving complaints? Where should we go?
Well, they're both. I mean, APRA has done indeed, the professional councils and the Commission have done a lot of work of trying to improve the consumer experience. So, you know, you might do it in a timely way. You might give more information to the consumers, but even if we did that with the best will in the world and did it successfully, I'm not sure that we still wouldn't get the similar results if we ask consumers about how they experience the regulator. And I think it's because of this role. Do we show them the doctor's reports? Do we have face-to-face interviews with them? You know, how do we involve them in an investigation? And at the end of it, what role do they have in terms of, as you said, restorative justice? And I think, as one of the speakers says, there's the regulator role, and that's in relation to what should happen. But then there's the consumer who might have different needs about having a conversation with the provider. I would be surprised if most of them want to have that, but I think there is a certain category of complaints where that is clearly indicated and should happen. Regulators traditionally don't see themselves in that role, but I think in Australia we have the framework through the complaint commissions in each state and territory to have much better relationships with the regulator, to accept those matters where the regulator has deemed no public risk or issues of health and safety, and they should then be dealt with at an individual level to satisfy their concerns.
And so what will be happening next then? You'll be publishing?
We will write up and analyse the results and publish them. And the APRA and New South Wales Professional Council and the Healthcare Complaints Commission are linkage partners in this grant. So it's, in a way, they're doing something that is fabulous for a regulator, putting themselves out to genuinely find out what is the consumer experience and how can we make it better for them. And APRA has been feeding results back in the last few months, and they clearly have taken many steps to resolve timeliness, amount of information, but the national law itself prohibits a lot of what information we can give to complainants.
And there has been lobbying on that to the Council of Australian Health Ministers?
Yeah, there has been, and we're certainly right now we're looking at putting amendments forward to the ministers for the national law.
So what's blocking that? Is it just a process that's underway, or...?
Well, it's not blocking. I think it's actually an understanding by regulators of what consumers are experiencing and how do we manage this in a way which is fair to providers, to the public interest, which is rarely looks at individual interests. So I'm not saying the individuals should say what the outcome should be. I think that's wrong. I think if they want dispute resolution, they need to go to another body, or if they want compensation, they need to go through the medical negligence system. But for regulators ourselves, I think we need to look at, well, how can we improve their experience? They have a lot to offer. It should be part of the narrative during the investigation, and it's giving them more weight. I think if I could summarise it in one sentence, how do we give equal weight to the complainant's narrative and experience as we do to the providers?
Thank you very much. It's very interesting. I really look forward to seeing it. There were some amazing slides there today.
Thank you.